Women's Health Connecticut is the largest OBGYN physician practice in the region and solely focused on women.
So we are one of the only practices in Women's Health Connecticut that is solely midwifery. The name midwife actually comes from the word with women.
Suzanne, I didn't realize that midwifery was more than labor and delivery.
Yeah, so it's a common misperception that midwifery and midwives only attend women during the labor and delivery process. However, we actually are certified in the state of Connecticut and across the country to take care of patients from menses through menopause.
So how does a woman choose a midwife for their health care?
So a lot of patients find us during their pregnancy, and then they stay on after their pregnancy because they were happy with our exceptional care and compassion that we provided. So as a Women's Health Connecticut practice, we offer full scope obstetric and gynecological care here. And then all of our wellness visits happen here in our office. And that is all the visits that occur during your pregnancy, and then also the GYN visits, annual pap smears, contraception visits, that sort of thing.
And when it comes to women's health care, what is your practice philosophy?
Education and prevention. So our appointments are longer than typical appointments, and that's really to have those conversations with patients so that they understand what's happening in their care. We want patients to have the tools to be able to advocate for themselves, and we will always be right next to them, advocating along with them.
So for expecting moms out there, what is the experience of having a midwife like?
So in midwifery, there's a term called the power of presence. So the majority of midwives actually deliver in hospitals. Only about 10% of midwives do home births. So we're there with them during their appointments, obviously. And then when they go into the labor, we're there with them at the bedside, providing support, giving them tips on different positions that might be helpful, and just watch and witness them relax and start to believe in themselves a little bit more. And it's such a simple process, but it's so powerful, and it's a fundamental of midwifery itself.
How many babies have you delivered?
I stopped counting. It's well in the thousands by now. I've been a midwife for 11 years and been lucky and privileged enough to really watch women transform through this process. And many Women's Health Connecticut offices have midwives in them, and you see them right along with the obstetricians. And the beautiful thing about that collaboration is that the docs and the physicians are learning from the midwives, and the midwives are learning from the docs, and it just is a meld of obstetric care that can sometimes be such a beautiful thing.
So we've talked a lot about the labor and delivery process with a midwife, but what does Women's Health Connecticut do after the baby arrives?
Yeah, so that's a huge part of this whole process. And at Women's Health Connecticut, we're able to offer the patient a ton of resources. Lactation services in which the patients see a certified lactation consultant to help with breastfeeding success, mood check-ins to see how they're doing and to see if there's anything that they might need more education on, to help them have an empowering postpartum period.
And I don't know the medical term for it, but they're cheerleaders, right?
Yeah. We're cheerleaders, we're advocates, we're family members, we're shoulders to cry on. We're there, we're in it, and I wouldn't want to be anywhere else.
Women's Health Connecticut provides comprehensive OBGYN care and compassionate support as you navigate through each stage of your life.